Alright, okay, so welcome back, dears. Yes, atong part 2 on urine culture. Alright, and for this part, we're going to start now with the procedure on urine culture. Okay, so we now first, of course, prepare the following media. Alright, so of course, 5% BAP, SBA, or MAC. Usually, ang primary plating media ra gyud for urine is MAC and BAP. So, because again, we're just looking for, of course, MAC because, di ba, atong considered the most common cause of UTI is your E. coli. So, it's very much reasonable nga mo gamit ang MAC kay, of course, gram-neg rods. Alright, and for 5% BAP, it's for the other causes of UTI, usually mga gram-positive cocci, so staph saprophyticus, and other organisms. So usually sila nang duhag yun ang primary plating media. But we can also use the following para yun mas specific. We have CNA or enterococcal agar for gram-positive. You also have the cysteine lactose electrolyte deficient agar, which prevents the swarming by proteus, which also can cause urinary tract infections ang proteus. All right? And chrome agar. Ang chrome agar, by the name itself, chrome agar, we identify the bacteria or the species by their colonies, the color of the colonies that they produce. Why? How do they do that? It's through the enzymatic reactions, which now produce the distinctly colored colonies for each species. So example, because of the different colored colonies sa chrome agar, makita nato na kani si E. coli, inani ang color sa colonies. Kanin enterococcus or other enterobacteriaceae. Again, mostly depending on the color of the colonies na ilang gina-produce. That's why chrome agar. Chrome meaning color, agar. Okay, so inana. All right. Now for the culture mismo, so after the media, no, what we do next is of course we mix the urine. Diba? General rule yun ninyo sa AUBF pa lang. You mix yun the urine para of course ito mga sediments that may have settled at the bottom kay ma-appeal siya sa pag-process. Okay? And we vertically dip, diba? Of course, a calibrated loop. Ayan. So, diba, kabantay mo ay yung calibrated loop na katong color light blue, right? So, kung gamay siya, ay katong color light blue, katong light blue na color, it's 0.01 ml. So, pag dip nimo sa urine, alright, katong mabilin na murag liquid sa loop, it's equivalent to 0.01 ml. Alright? And katong naay uban na nakadawat og white na calibrated loop, that's equivalent to 0.001 ml. Alright? 0.01 ml or about 100 UL. Alright? And 0.001 ml, 1,000 UL. Alright? Okay, tama ba akong conversion? I think okay. And of course, if low concentration ato ang samples, then of course, it's imperative that we use much larger amounts, okay, para mas daghang makuha. So here's an example of a picture. So we dip yun, all right? And then ang mabilin kaning sa loop diri na liquid, that's equivalent to the corresponding volume, all right? Depending kung unsa na loop imong gigamit. If katubang 100 UL or 1,000 UL, okay? All right. Okay. So we now go to the again culture. So take one agar plate and then again, grid streak, di ba? How we perform the grid streak. Start at the center, and then, di ba? Start at the center, and then one up, one down, okay? And perform the grid streak. So, ana. Alright? Okay? Until the end. Or, pwede po, di ba? Ana, paana ka. Alright? So, muna siya ang grid streak technique. Okay. Alright. And, multiple times and repeat steps to remaining agar and incubate lang at normal incubation temperatures. Alright? So, yeah. So, grid streak. Okay. So, continuous ni siya, guys, ha? Dili na ka mag-flame, like, usara yun ni. Starting sa yung loop, right? Ana, 1, 2, then ana. Alright. Now, after, of course, incubation, we count down the number of colonies. Now, how do we count the colonies? Of course, i-count na to ang colonies na nasa tunga, okay, and ang naa sa kilid. Alright? So, we count the colonies na nasa tunga, okay, and we count the colonies po na naa sa kilid. Alright? Or kung asa nitubo aning atong pag-grid streak. Alright? Okay, so muna siya ato ang pag-count. Alright, and interpret using sa next slides nato na pag-interpret and perform appropriate workup for isolated colonies. Okay. Now, we now go to your urine culture na pag-quantitate or how do we solve, right? Kay, di ba, as mentioned, this is a quantitative culture. Alright. So again, inoculation, grid streak, using calibrated loops or dilution methods ba? And as mentioned, primary media nato is only BAP and MAC. Usually, kararagin silang duha. Because again, of the pathogens nato ang ganahan ma-isolate. Alright? Calibrated loop, again, as mentioned, inserted and withdrawn vertically. And grid streak technique. Okay? Alright. Now, how do we solve for colony counting. So again, we solve them, or we use the terms CFU per ml, or colony forming units per ml. Now, what is a CFU per ml? Colony forming units is only an expression. Actually, colony forming units is equivalent, or it's the number of colonies yun na makount nato. But since we cannot count every bacterial growth mananakitan, we express it as colony forming units. So therefore, ang usa ka colony forming unit, that's equivalent to pila na ka bacteria inana. Okay? So because again, dili man nato ma-identify, or di na nato ma-count individually kay daghan man kayo sila. So we just use the expression CFU per ml. Okay? All right. Now for the general formula, this is a formula used if nag-dilute ka, okay? So, example, naka-urine na medyo concentrated, nag-dilute ka using saline ba or distilled water, alright? So, this is what we follow, okay? So, again, conversion factor, since your inoculum volume, we usually set it as in UL, alright? Okay. And dilution factor is reciprocal of dilution, okay? So, example lang, you have a colony, you have a urine culture, gidilute daw nimo siya og 2 ml na urine, alright? Gidilute po mo siya og 4 ml na water, okay? Or saline na lang, saline. Okay? Alright. And then, gi-plate nimo siya, gi-grid streak and all, and after incubation, you counted, let's say, 57 colonies. Alright. Now, of course, how do we solve that? So, first, we determine the DF, the dilution factor. Okay? Alright. Dilution factor. So, example, okay, dilution factor is 2 over 2 plus 4, okay, so 2 over 6 or 1 over 3. So your dilution factor is 3, okay, so 3. Next, alright, since ml naman ni siya, we don't need to convert kay ml naman, okay, alright, so example 57 over inoculum volume di ay in UL. So, kailangan na ito siya i-convert di ay UL. So, 2 ml convert to UL, that's equivalent to, pila man ni? 1,000. 0.002 ba? 0.002? Tama? 0.00, tama ba kung pag-solve? UL. Okay. Times the conversion factor, which is ang 1,000. Actually, same ra siya, no? Sila taga, wala tagbuang. Okay, alright. Pero sige na lang, 57 colonies, 0.002 UL. So, wala convert ani 1,000 UL over 1 ml. So, cancel. Alright? Okay. Tapos, times dilution factor na 3. Okay, so, basically, nana siya pag-solve, guys. Okay, so, I think, sayop din yung 2 ml kay calibrated loop man di ay, no? So, either 100 UL ba or 1,000. But anyway, sige na lang. Alright, so, always remember the UL dyan na inoculum volume, and then we convert it sa 2 ml. Okay, now let's say daw na wala kay dilution na gigama. Okay, so example lang yun. Because again, according to Ma'am Teddy, ni-ask ko ani kay medyo bugo kog math jud as in. So, akong gi-ask Ma'am Teddy, kung Ma'am Ted, ganun ta mag-dilute. Okay, because again, sa una daw, walay dilution na nahitabo, or walay calibrated loops ang ubang labs. That's why what they do is they dilute. Alright? So, munang naani na formula. But now, most of the labs, they have calibrated loops naman. So, usually, diretso na. So, example daw, example lang, di ba? So, 100 UL, alright? Tapos, of urine, gamit sa calibrated loop. And then, of course, giplate and all that. And then, after incubation, count na 45, sige, colonies. Alright. So, for solving ani, guys, you don't necessarily use this formula na. What you do lang is, kaning result na 45 colonies, it's basically saying 45 colonies per 100 UL. But, since we want ML, so we just convert the UL to ML. So, example, 45 colonies, di ba? Over 100 UL. So, ato na siyang i-multiply og para ma-convert ni to ML. So, 1,000 UL over 10, over 1 ml. Okay? So, cancel. Alright? So, you're left with CFU na per ml. Okay? Or in short, para mas dali, this is equivalent to 45 times 1,000 over 100. Okay? Or basically saying 45 times 10. So, ang 10 ato ang factor na easy. Alright? So, therefore, you will have 45 450 CFU per ml. Okay? Alright? Or if ato na i-convert 450 CFU per ml para mahimo siyang exponential, 4.5 times 10 to the 2 CFU per ml. Okay. Ayan. So, basically, that's it for calculations. I do hope na gets lang, no? Again, if walay dilution, like let's say, sa imong problem, undiluted ang urine. Alright? So, you did not perform dilution. So, if, in ana ang case, kanira yung buhaton, you're basically saying, kung unsay mong colonies na nakitaan, that's equivalent na to the volume of urine. So, example, 45 colonies per 100 UL. So, since 100 UL man, so we have to convert that to ML. That's why we have this factor, okay? And ang shortcut pag yun ana, okay, it's similar, equivalent na to 1,000 divided by 10, alright? By 100. So you have the factor na 10. So 45 times 10, muna yung shortcut, 450 CFU na per ml. Okay? So basically, that's it for calculations. Alright. Okay, now, what do these results mean? Ayan, so dira na ta mag-interpret. Okay. Okay. So first one is, of course, if you have greater than equal to 10 to the 4th CFU per ml of a single pathogen or for each of 2 potential pathogens. So example, naka-isolate ka, let's say lang E. coli. Okay, E. coli na ang iyahang CFU per ml is greater than equal to 10 to the 4th. Okay? And ang imuhang specimen is from a clean catch, midstream, catheterized ba, a pyelonephritis na patient, acute cystitis, or asymptomatic na bacteriuria, your workup should be complete. Because again, we are now expecting that this is the potential pathogen that is causing the disease, okay, at this number, greater than 10 to the 4th. So, taas siya na number, daghan, yung usa pa jud ka pathogen ra, or usara imong na-isolate na colonies, or usara ka-isolate na bacteria. So, you're assuming now that that is now the cause of the disease or nyagikan pagyud ani na mga specimens. So, imuhang workup should be complete, alright? So, from identification until AST, alright? Okay, alright. Okay. Or, again, pwede po 2 ka potential pathogens, example, E. coli and Proteus, imuhang na-isolate niya. Each of them, ang ilahang count or CFU is greater than equal to 10 to the 4th. So, you have to perform a complete workup for each. Okay? Because you're expecting na could be na either of the 2 or silang duha gyud ang nakakos sa UTI. Alright? Next, greater than equal to 10 to the 3rd lang of a single pathogen. Yang imuhang specimen is still the same. Clean catch midstream, catheterized, symptomatic males or from someone na acute urethral syndrome. Recall, di ba, acute urethral syndrome, na ay dysuria, painful urination, and napag-pyuria, so na ay WBCs sa ihi. And gikag og males daw, so kung males, di ba, usually rare kay ang UTI sa mga males, alright? And CCMS urine or catheterized ba ang urine, alright, ang specimen. So still the same, complete dapat imong workup. Because again, ang imuhang number is greater than equal to 10 to the 3rd. So that's quite a lot. Niya, usara pud ka pathogen mong na-isolate or usara ka bacteria mong nakuha. So therefore, that could mean na that is the cause of the UTI. Alright? Okay. Alright. So if inana imuhang result niya from these specimens or ang conditions na naa, complete dapat imuhang workup. Now next, greater than equal to 3 organism types with no predominating growth. So example, naka-isolate ka tulog yun. Like example, Neisseria something. You have also like staph na coagulase neg. You also have lactobacillus in ana. And they all have the same growth ba? Like walay ni daghan, walay gamay nila. Like all of the same growth. Like no predominating growth. So that only means it's, nyagikan pag yung CCMS or catheterized urine, then that only means na it's a possible contamination. Ask for another specimen. So dili ka mo perform og any workup ana. Because again, 3 mo na isolate. And then greater than equal to 3 ha. Dayon wala pag yung growth or walay usa nila na murag mas daghan, okay? And walay usa nila na murag think ka na possible pathogen. All right? So therefore, it could only mean that it's a contaminant. Contamination siya. So ask for another specimen and you don't perform any of the workup. Okay, all right. Next. All right, either 2 or 3 organism types with predominant growth, 10 to the 4th, 2, greater than equal to 10 to the 5th of one organism, and less than 10 of the other organism. So example, daghan kayong chika, no? So example, let's say E. coli, all right? And Proteus imuhang duha ka organism. Let's say kani siya ang 10 to the 4th or let's say greater than equal to 10 to the 5th ni siya. And kani ang greater than 10 to the 4th. Okay, ayan. So, inani atong situation. Muna siya gipasabot, ana. Alright? Okay. So, example, ang gikan siya sa clean catch midstream. What we do lang is, we do a complete workup, ani, which is the predominating. Okay? And kani kay description na lang. Okay? Gets ra? So, kung kinsa tong murag mas daghan na count, okay? Mas daghan na CFU per ml, siya imong gaman og workup because siya ang considered to be the predominating organism. Alright? And the rest nimo is description na lang. So you don't perform workup on that. Like you don't perform biochem na, you don't perform AST. Alright? So ang imurang performan og biochem, AST is katong predominating, which in this example is E. coli. Alright? And the rest kay description na lang. Okay? Alright. And less than greater than equal to 10 to the 2 of any number of organism types niya ang specimen mo is suprapubic or any surgically obtained specimens because again, we're considering or we're expecting na these are sterile specimens. Bahala gamay pa na siya, bahala kinsa pa na siya, you do a complete workup. Why? Because we are assuming that that is the cause good of the disease. Kay gikan siya og usa ka sterile na site which is your bladder, suprapubic aspirate, or any surgical obtained specimen. Okay? Bahala gamay ra siya, greater than equal to 10 to the 2. Dayon, any organism ba gani na siya or bahalag kinsa pa na siya, you have to do a complete workup. Because again, we are expecting nagikan siya og sterile na site and supposed to be under normal circumstances, walay kagaw na naa didto, nya karon na naa na. So we have to do a complete workup. Okay? All right, ayan. So, okay, so for criteria for quantitation, significant na bacteriuria if greater than equal to 10 to the 5th ang CFU per ml of a single potential pathogen. So example, greater than equal to 10 to the 5th of E. coli, Staph saprophyticus ba, etc. Alright, indicative of infection, UTI may be symptomatic or asymptomatic and may or may not be accompanied by pyuria. Okay. Alright, less than 10 to the 5th ang CFU per ml between 10 to the 4th and 10 to the 5th may be indicative of infection, may be found by an upper UTI and UTIs by slow-growing gram-neg bacteria or Facilis organisms, may be caused by physiochemical factors, antibiotic treatment, increased urine flow, hydration, and low pH. Because again, kanina mga physiochemical factors, it could affect the growth of the bacteria na naa dito. That's why dili kayo siya muabot og greater than 10 to the 5th. Okay? Alright, so if less than 10 to the 5th, 10 to the 4th, to 10 to the 5th, then it could be found in upper UTI and lower UTI. So it's still indicative of infection. Okay. Alright. And mixed isolation represent contamination. So meaning daghan kang na-isolate, not only one. Alright? So however, the predominant growth with pyuria, so katong organism na daghan daw, greater than 10 to the 5th, and small numbers lang of other organisms. So example, again, katong ganina, E. coli, Proteus, etc. Nya ang E. coli ang mas daghan, predominating, nya ang uban kay gagmay na. So it's considered daw significant katong na ay predominant growth. Okay? Alright. Ayan. Next one. Clinically significant colony counts from men and children are often less than 10 to the 5th. That's why ka-recall mo ganina, greater than 10 to the 4th pa lang sa mga males, di ba, symptomatic, considered significant na siya. Because again, of the rationale or of the principle or of the idea that again, men and children are often less na magka-UTI. Okay? Alright. Okay. And detection of any organism, again, in suprapubically aspirated, bahala ba na siya low count or mixed isolation, dagan kang na-isolate, basta ganigikan siya suprapubically aspirated or other surgically acquired specimens, it's considered as significant yun. So, perform complete workup. Alright? Okay. Colony counts of less than 10 to the 4th are not significant or indicative of infection, generally. But if kani siya na-count, rani mo, gikan sa Osaka specimen na suprapubically aspirated, then that is now significant. Okay? So it would depend on the specimen nimo. Alright? Okay. Now we go now to the potential urinary pathogens. Of course, first is E. coli, which accounts for 90%. So the most common cause of UTI, naku, wag na mag-isip, it's really E. coli. Alright? Next, you have Klebsiella, Enterobacter, and Proteus, usually from hospital infections, so mga nosocomial. Alright? And often, sila ang naay antibiotic resistance. Staph saprophyticus, as mentioned, it's the common cause of cystitis in young women. Sexually active young women, less than 25 years old. Alright? And Pseudomonas aeruginosa, recurrent, complicated, catheter-associated na mga infections in still hospital patients. Okay. All right. Ayan. Next, you have Staph epidermidis, maybe a contaminant, but also maybe a potential pathogen if ang patient is immunosuppressed or catheterized. Because again, maybe sa pag-catheterized na ay naabot or na ay skin flora, normal skin flora na naabot or na-appeal. So that could be Staph epidermidis, right? Okay, you have Enterococcus faecalis, infrequent cause of UTI pero mainly pa rin in hospital patients. And Candida species, catheter-associated, diabetics, right? I don't know if na-mention yung CM, but in diabetic patients, if urine sa diabetic patients, one of the things na imong makita dito na nag-predominant of growth is yeast cells or candida. Because again, they love a high sugar environment. Okay, so munadagan kayong yeast cells makitaan in a diabetic patient na ihi. Alright. Okay. Renal transplant patients and those receiving broad-spectrum antibiotics. Because these broad-spectrum antibiotics, if sige Japon, it could be that these candida na normal flora or pathogen magka-cause of resistance noon. So mas mo proliferate sila. Okay? Alright, so these are just the list of potential urinary pathogens. Now, what does a complete workup contain? Of course, one is gram stain of a morphotype identified on BAP. So sa BAP na makuha, guys, kaya sa MAC, na anay mga inhibitors ang MAC na pwedeng maka-affect sa yung gram staining results. Alright? So sa BAP makuha. Next, you have identification. Again, follow the scheme. So if nakakita ka gram-neg bacilli, kakita ka gram-positive cocci, yun sa atong mga biochem. So refer na po sa atong biochem. And then, of course, you perform AST. Alright? And make a final report. So muna siya complete workup. From gram stain, then you identify the morphotypes na specific or na significant. And then biochem ka, refer to your biochem tests. And then your AST, and then final report. So basically, inanadjud ang flow sa to ang Bacte lab from the start to finish. Inanagin na siya. Alright? Okay, so colonial morphology, biochem, CFU per ml, because again, this is urine, quantitation, and AST and your significance. Based again on the counts na itong nakuha and the method of urine collection. So, kato atong table na gi-mention ganina. Alright? Okay. And basically, that's it. That's all for urine culture. Alright? So, quite a straightforward pa rin na discussion. So, mura dyan siya importance nimo ang quantitation sa urine culture because dira mo base ato ang pag-establish sa infection in a way if it's really significant or dili. Alright? And the different urinary pathogens and atong calculations. Okay? So, please take note of those. Alright? So, again, that's all for urine culture. If you have any questions, guys, don't hesitate to question. Okay? Ask lang sa atong GC or chat me. Alright? So, have a great day, dears, and keep safe.